Hi, everybody. Dr. Jerry Grant here. I am eager to talk to you about this topic of Chiari and quality of life. It's a very hard act to follow when we bring up that video of my good friend, Dr. Tim George. He just made so much impact on all of us. He was actually a mentor of mine before I got to Duke, and he had left just when I got there to Dell Children's. So he's been a mentor for me over many years, and actually was the first one to get me involved in ASAP for Chiari and Syringomyelia. So we all missed him, and I really appreciate you doing that nice piece on him. So this is talking about Chiari and quality of life. This is something that I've been very interested in at Stanford to pull together. This is a interest for a long time of mine, and I hope to convey to you how much we have, how limited knowledge we have of this topic, but how important it is, I think, for the field that we continue to strive to understand this better. You know, we always think about Chiari and the back of the brain and how the cerebellum is way down low. We focus on the tonsils of the cerebellum. This particular child has hydrocephalus as well, or at least increased ventricular size, ventriculomegaly, and both can contribute to changes in cognition and quality of life. I think the question is, how much does the cerebellum alone, contribute to changes in how people, can function, on a day-to-day basis? When you start thinking about memory and IQ and some of the reading difficulties, are these related to Chiari? Or are they not? Is there any basis for this? And this is something that we're very interested to uncover. I think it's some of the mysteries of Chiari and how it can cause different effects that way beyond some of the more common ones that we think about. So this is a database that was looked at, now 5 years old, that looked at symptoms. The National Conquer Chiari Registry tried to capture some of these details, and you can look at the symptoms on this chart, which you can see, some of the most common you'd expect, with some of the headaches and difficulties with vertigo, are very common, dizziness, way beyond just occipital headache, with coughing or bending or straining. There's so much going on here. Even sleep, is something that we pay much more attention to, both obstructive and central sleep, and that was talked about in other talks, as well as some of these other areas like sweating, dysautonomia, some of the fatigue, which has been highlighted a lot in Chiari. Now, even more interesting are the tables in that same paper that look at some of the neurocognitive or psychological concerns with these patients, and 44% said they had experienced some concerns about memory, even speech issues, depression, mood problems, even in 30%. 20% had some anxiety disorder. These are just too common that would not be usually present in the normal population. There is something about Chiari that is raising our risk of some of these comorbidities. It may not be a direct relationship, but there's a very common association with some of these comorbid symptoms, signs, and other diseases that would usually be in a separate bucket, like depression, for example, bipolar disorder. If you look at some of these findings, you can see on the left are there some of these different areas like depression, mood disorder, obsessive compulsive disorder, memory problems, anxiety, ADHD, PTSD. These are very common in these Chiari patients, way more common than you'd expect, which is one thing, an important principle I would like to relate to you, that this is something that is very real. We don't understand yet in terms of how they relate, but way more common than we would have expected. So cognitive deficits, why do they have that? Is this a direct injury of the cerebellum itself? Is it the pressure of the tonsils of the cerebellum on the brainstem? That's structural. Is it something in prefrontal cortex, the connections of the cerebellum to the frontal lobe? Or is it some secondary effect of anxiety, depression, chronic pain. We'll get into this a little bit. The power of chronic pain is amazing in what it can do to affect cognitive performance. There's a negative relationship there. The more chronic pain someone experiences, they're not going to do as well on some of these cognitive tests and measures that we apply on neuropsychological testing. We see this in the military all the time with history of PTSD or headache. Their cognitive scores suffer. Is that a primary brain injury issue, or is that secondary to the pain and headache that they experience, or the PTSD, post-traumatic stress? We don't know. They're so dirty, it's hard to tease this out. But we have to try and have to continue to collect these data to understand it better before and after surgery. Is it the surgery itself? Are we doing this somehow to patients and raising the risk for some of these conditions? And then kids versus adults. We clearly see this much more commonly in adults, but there are quite a few warning signs and cues, and even in the children, that I see. And now we look for that. We're testing for that, in the younger patients. So you can look at some of these cognitive effects in Chiari I. I'm not really talking about Chiari II here. Dr. Luciano, who studies Chiari quite a bit as well, has looked at this in the past. We can look at working memory. We can look at some of this test, like the Stroop test here, where you're looking at colors, and you have to say the color despite what you see in writing, or despite the color of it, what you see and how you read it. These are tricky. You have to really focus and be very attentive to do these exercises. But these have been shown to be quite different in Chiari patients. Why is that? Even when you account for the chronic pain, they were also different, which I think is very interesting. So you can look at compressive effects like I described, cerebellum, brainstem. Vascular has always been brought up. We have no proof of that. Chiari doesn't usually compress the vertebral artery. Of course, there is microcirculation and maybe ischemia of the tonsils where they're not getting the blood flow. We always see at surgery sometimes the tonsils are white in appearance because they're just not getting that flow. Does that affect cognition in some way, directly or indirectly? Is it the repetitive pulsations from Chiari that causes the damage, like we see in concussion with repetitive strain, white matter strain, neck injury, things like that? Versus very non-specific effects from fatigue, from pain itself, anxiety, depression, and how that affects your psychological health. Clear hormone changes, biochemical changes. These have been documented, and how that might affect some of these cerebellar circuits are just unknown. We do fancy imaging. We're doing a lot of this at Stanford as well as other sites to look at DTI and Chiari. We need to link this as much as we can to signs, symptoms, who gets surgery, who doesn't. We need to study this, to look at what changes after decompression. There is some correlation with cognitive function. I think these are really interesting studies. There should be more of them. There are very few, that really try to link some of the fancy imaging we're doing, with cognition before and after surgery, or just following patients, called the natural history of Chiari I. We can find very specific correlations now between different areas of the brain, particularly in the cerebellum, and the connections from the cerebellum, which are in the middle cerebral peduncle. Does this help us in some way? Find out who might need surgery or who might be more affected by the Chiari? Not so much, unfortunately. We have incredible imaging we can apply to Chiari now. All the 4D flow imaging we're doing, called augmented MRI, to look at changes in the brain and motion in space, and how we augment that now to look carefully. The physicists just love showing us those videos. They're beautiful to watch, but what does it mean? We still don't understand it. Now we can look at patients that underwent surgery or not, and these are 3 graphs you can see, and over the bottom you can see different areas of executive functions, such as or spatial cognition, verbal fluency, naming, verbal memory, processing speed. These are all different categories that try to assess neurocognitive function in some way. These are very common tests. But you can look at the table, and that the top plot way up high is Chiari that have had a decompression. I'm sorry, this top one is the controls way up high. And these two graphs below are Chiari with or without decompression. And it's concerning to see this because it makes you worry that, what is going on here, that even with surgery, the scores do not improve very much. Now you see naming improvement maybe, but other scores are pretty stable, which we don't like to see that. Now these are adults, maybe it's too late, but I wouldn't get depressed about this. We just don't understand this well enough in terms of what happens, because we do see early improvement, and anecdotally I've definitely documented that even in adults in terms of what happens. Now there's the Chiari Registry Project that looked at assessing surgical outcome and particularly paid attention to attention. And of course, the understanding that chronic pain, of course, will affect your ability to be attentive. This was brought out a lot, in Chiari. And if you look at outcomes of surgery in general, this is for adults, not specific to cognition. These three scoring areas have been shown to be the most valid. Now, what does valid mean? It just means that they responded to the surgery. So with surgery, there was a clear change in these three measures. Now, one is the NDI. NDI really is an index to look at neck pain. It's a common score we use for spine surgery for the neck, and that makes sense, right? Interestingly, headache scores did not change as you'd expect. Was not a great valid measure, but NDI was much more about the neck. So you can understand that, of course. SF12, this PCS, that is also something commonly used, way beyond Chiari. It's something that tries to get an understanding of quality of life, and with that, there are other questions I think that are very interesting, such as have you felt peaceful or calm in the last period of time? Do you have a lot of energy? That's something that's brought up as well. So I think these are really interesting questions, and we don't know if that is swaying the recovery after Chiari, versus this European EQ5D, which is a European score that looks at mobility and self-care and pain, discomfort, anxiety, depression. What's interesting, there's also an overall global health component of this. Say the worst health is 0, best health you could ever imagine is 100, and the patient has to rate their health on a global score. Maybe that's what's been more powerful and valid here. So we just don't understand it, but I'm glad some of these are being done, because this is what we need to do more of. And these three scales are relevant, I think, for an adult. We don't know as much about the kids, but you can see some of the differences that go into these scores in terms of why they make sense, with Chiari. It's physical, it's psychological, it gets to bodily pain, mental health, and there's a theme throughout all of these. Now, looking at cognition in Chiari, there's systematic review was just done quite recently, which I think is exciting. People are now talking about this more, which is really good to see. There are cognitive domains with Chiari, cerebellum, connections all the way up to prefrontal cortex. Look at all the changes that you might expect in terms of problems that you might see. There's a cerebellar cognitive affective syndrome. Nothing to do with Chiari, just cerebellar syndrome. Look at the overlap of these same signs and symptoms. Problems with depression, irritability, aggression, obsessive behaviors, pain, anxiety. Very similar to some of the cognitive domains brought up in Chiari. And I think this article is very, very good because it tries to unfold some of these and look at the association. Of course, we have no proof yet Chiari causes these, but there are clearly associative conditions of cognition that are definitely affected, in these patients. Now, the cerebellum hasn't got a lot of credit. We always think of the cerebrum, the larger brain up above, the cortex, frontal lobe, parietal lobe. Well, what about the cerebellum, the little brain? Well, I wouldn't call it so little. There are 50 billion granule cells in the cerebellum, which constitutes more than half the neurons in the human brain. Look at that. The cerebellum is very small, right? In terms of volume in the brain. More than half the neurons in the whole brain are in the cerebellum. If you unfold the cerebellum, the cortex has approximately the same surface area as 1/2 of the whole cerebral hemisphere above. This is a real thing. Look at this here. This is looking at a recent neuron paper, looking at the areas of the cerebellum in terms of what they're responsible for. Take, for example, number 5, you can see divided attention, visual object recognition. Take 4, also visual attention. Looking at verbal fluency, number 6. Okay, these are real areas of the cerebellum accountable for some of these different functions. On the bottom, you can see all the color-coded connections in the top part of the brain from the cerebellum. Cerebellum goes so many different places through these different peduncles and tracts. Plays a big role, much more than we really understand. So please don't call it the little brain anymore. We just don't want to undermine what it could be doing. Now, this is a study that we're doing now. It's ongoing. I'll be publishing this soon, looking at quality of life in the kids after Chiari and following these patients very carefully. And I just want to give you a highlight for this. You can look at before and after surgery. This is about a year apart, looking just at some of the PROMIS scores that look at fatigue. I think it's a very interesting area. Now, if you look at almost always fatigue, that's the yellow, versus the blue, never. You can see after intervention on the right, there's a lot more blue, a lot more never scores of fatigue. So there's definitely something going on that improves their overall fatigue that they might have before. Look at some of the questions. Too tired to enjoy things he or she likes to do. Too tired to do things outside or to do sports. This is a very difficult time to assess some of these, as you see with the COVID-19, because no one's getting outside. Many kids are not exercising. They're not sleeping. A lot of their Chiari symptoms are worse. No question about it. And it's a difficult time to assess how they're doing because of this pandemic. But I think these are the type of scores we need to better understand what's happening. Lastly, this is a slide that was something very interesting to me, to look at parent versus child scores. So any child over 8 years of age or so, will fill out their own scores, and their parent will fill it out. And I'm happy to see that there's a lot of congruency. So there's a lot of parallel, similar scores that the child and the parent, are reporting, which is called the proxy. I think that's really good to see. We want that to be as close as possible. The parents know these kids the best. You can't get this in the adult side, right? Because you don't really have a proxy for the kid as an adult. But there are outliers. There are definitely some that the pain scores are way more, say, than the child put down, and then vice versa, where the child is way more than the parent, which is, sad to see that the poor child is having so many more symptoms when they have this chance to report it on their own. But most are quite similar, which is, I think, really good in terms of understanding. But the outliers we need to pay attention to, and we're studying those in particular right now. If they are not congruent, my worry was they're not going to get better as much from an operation, say, because of expectations. So, in conclusion, the cerebellum is not so small. I don't want you to come across that here's this small area in the back of the brain that doesn't do a whole lot. We're just at the tip of the iceberg to really understand the cerebellum, and especially the cerebellar tonsils. We need to track the effects of Chiari, with or without surgery, on both cognitive and psychological domains, way beyond the physical complaints of headache. And it's hard in the clinic, say for the surgeon, to find out, is the kid or adult really doing better? That's why we rely on some of these surveys, like the spine teams have done. These are happening in the background, and they've taught me so much here at Stanford because they're seamlessly happening, these surveys, to assess how they're doing. And that's what I've adopted for Chiari. I don't want to ask them in the clinic room how they're doing and going all through their scores. I don't want them to make me feel good. I want the kid to be better. And the better we can assess that before and after, I think the better we'll be able to help, these patients. As Jimmy Valvano, basketball, don't give up. Don't ever give up. There's so much we don't understand. There's cerebellar dysfunction. There's instability of the craniocervical junction. There's the pseudotumor, CSF pressures, intracranial hypotension, the low pressure symptoms. All of these relate to Chiari. Many of these could be reasons why a patient is not getting better, with or without surgery. So we need to keep looking. We need to be aggressive to work these patients up for any of these things that could be causing a problem. And all of these I have found to affect, the cognition and quality of life of patients. So we have to be very, very careful on how we put them in single buckets or we think we understand it. Chiari is not so simple. Recognize the complexity, and remember the cerebellum is not so little. So thank you so much. It was a real pleasure to talk with you today. ASAP is a terrific organization, to really focus on you as the patient and families of patients to better work with us and help us understand what you all are going through for Chiari and for Syringomyelia. So thank you so much.